U.S. President Donald Trump has extended the nationwide social distancing guidelines until the 30th of April. Mr. Trump had previously said he wanted to see the country return to business as usual by Easter. But he now says that the coronavirus situation in the U.S. will continue to deteriorate, estimating the peak death rate will hit in 2 weeks.
On Easter, we probably, well, that could be a peak. That could be a peak period. That could be the peak, sadly to say, that could be the peak number of deaths before it starts coming down. No, that was aspirational. We had an aspiration of Easter. But when you hear these kind of numbers and you hear the potential travesty, we don't want to do anything where, we don't want to have a spike up.
The government's top infectious disease expert, Anthony Fauci, predicts the U.S. could see more than 100,000 deaths and millions infected. Dr. Fauci calls the extended guidelines prudent to curb the spread of the virus.
It's very difficult to quantitate it because you have two dynamic things going on at the same time. You have the virus going up and you have the mitigation trying to push it down. But the decision to not prolong, but to extend this mitigation process until the end of April, I think was a wise and prudent decision.
And for more, Simon Marks joins us from Washington, D.C. Simon, so the president has acknowledged that things will get worse, but he's saying that the death toll will peak in 2 weeks. In a country as big as America, is this a realistic assessment?
Well, he did use the conditional word could when he said that, didn't he, Glenda? The death toll could peak around the Easter holiday here. And I think that he was really talking about the situation in New York City as opposed to the national picture, because no one here thinks that nationally the death toll is likely to peak within the next fortnight. There is a contradiction inherent in the announcement, the U-turn that the president made last night here, because on the one hand he's extending the safe distancing guidelines that he wants the country to follow until the end of April, but he's saying that the economy won't be able in any meaningful way to reopen, even in parts of the country, until the beginning of June. So he's very much hedging his bets, and I think this may be just the first moment when the president allows many of these timelines that he's been imagining about over the last couple of weeks to slide, because, all that talk about, excuse me, all that talk about getting the economy reopened by Easter, I mean, that has now clearly completely evaporated, and it's going to be much, much later even than June, public health officials think, before anything here is going to get back to what Americans would consider to be normal.
Well, talking about fatalities, Simon, Dr. Fauci, he's talking about numbers in the hundreds of thousands. He mentioned 200,000 Americans potentially dying of COVID-19 and millions more infected. Tell us a bit more about sort of efforts being made to manage or mitigate this crisis.
Steve, I think that was the most startling thing about President Trump's appearance in the Rose Garden last night, was the fact that the president suddenly acknowledged that the death toll here in the United States could end up being between 100,000 and 200,000 people. And he argued that if the United States now could hold those numbers to that level, that, he thought, would be, in his words, a great victory. He had clearly been very alarmed by models that were predicting a death toll here in the United States of 2.2 million. So the mitigation efforts are the guidelines that he has in place, but ultimately those are not being in any sense nationally enforced. Everything is falling to the 50 individual states that make up the United States of America. And so you have this patchwork still of different arrangements, no restrictions really on travel or movement. And as a result, many public health experts on the president's coronavirus task force and outside it fear that this virus is still in a position to course unchecked through American society.
Simon, so generally, are people following the guidelines and rules on social distancing, as in not going to crowded places? How concerned is the average American now?
Well, I think it depends entirely where you go, and one of the difficulties here has been the messaging from the government in Washington. This is a President Trump, who just a few weeks ago was telling Americans, don't worry, like a miracle, it will simply go away. Even this morning, acknowledging that there are still going to be at least another 100,000 deaths in the country, the President is giving interviews saying that the country is very close to defeating this invisible enemy. And so many Americans, I mean, I can tell you here in Washington, D.C., farmers markets were open this weekend. There were plenty of people attending them. And at one that I drove past yesterday, there was no safe distancing taking place at all. So it depends where you go, in which parts of the country. I think New York, because of the numbers there, people are much more aware of the situation, but reports from the middle of the country suggest that states like Oklahoma, for example, Mississippi, Alabama, life is pretty much resuming as normal there because they're still facing low numbers of infections. Dr. Fauci said over the weekend every single metropolitan area in the United States will soon have a large number of cases of COVID-19. And so, you know, if behavior doesn't change, those infection rates are going to continue spiking upwards.
All right, thanks for that. Sam Mark speaking to us from Washington, D.C.